Hello, my name is Laura Azzi, reporting to you from Afternoon News. Today we have a special segment with 3 doctors from the Little People Big World Organization of America to talk to us about the most common form of dwarfism, achondroplasia. To start us off today, we have geneticist Dr. P. Davis.
Hi, thanks for having me.
Now why don't you start off by telling us the causes of achondroplasia?
Well, on the fourth homologous chromosome, there is the FGFR3 gene, and that is the gene that helps bone growth. Now, see, there are 2,250 bases on this particular protein, and the base affected is the 1,138th base, and the normal 1,138 base should be guanine, but in 98% of the cases of patients who have achondroplasia, it is transcribed as adenine instead of guanine. So when it is transcribed during the process of transcription, it is transcribed to uracil, which changes the amino acid from glycine to arginine.
Now what is the pattern of inheritance?
Well, it is autosomal dominant, which means that with one parent that has the dominant trait, it will pass down to that child, and the child will have the disorder.
Is there any cases where it ever turns deadly, or?
Well, in some cases, both the parents will, give off both dominant alleles. That's called double dominance. And what happens when the child has double dominance, there are a lot of health complications when it's born, there are organ failures, breathing problems, and ultimately it dies shortly after birth.
Wow. Well, right after the break, we'll be back with Dr. A. Song. Welcome back to the Afternoon News. Now we have Dr. Anna Song here to talk more about the symptoms of achondroplasia.
Thank you, Laura. The function of fibroblasts is to stop bone growth in the human body. And like Dr. P. Davis mentioned before, there is a point mutation that occurs in the FGFR3 gene where the protein fibroblast is overly active. This causes some skeletal development issues, which also causes the human body to send many stop signals in your bone growth.
Now, what are some symptoms that can be present when someone has achondroplasia?
Well, one of the symptoms is having small hands and feet, like shown. And there can be potential obesity in the future. There is also many neck problems and hearing problems. There is also an enlarged forehead and a flatter nose. And there can be many painful spinal and joint problems. As you can see here, this is a more realistic version of what a family with achondroplasia might look like.
Well, thank you, Anna.
Thank you.
Up next, we'll have Dr. Holly Greenwood here to talk more about the cures and treatments. For the final interview of the day, we have Dr. Holly Greenwood here to talk more about the cures and treatments for achondroplasia.
Thank you for having me.
Why don't you start off by talking about the life expectancy?
Well, the life expectancy of one with achondroplasia is one of a normal person, but if they have the double down occurrence, then they might die minutes or even hours after their birth.
Wow. Can you talk about the treatments and cures if there are any?
Well, because this is a genetic disorder, there is no cure, but there are many treatments and medicines that can be used to fix any problems. So, for example, medicine is biomarin, and that can be used just to manage all problems that come with achondroplasia. But as for treatments, there are a lot of things that people need to do to manage any issues. So, first off, they may have hearing problems, so a way to fix that is to have tubes inserted into the ears to drain the fluid. Then they may have cleft lip or and bowed legs, so they may need surgery to correct that as well. And they need to also go to an orthodontist if they have a small jaw or crowded teeth. And one problem that is very common is back problems. So they may use back braces to keep the problem at a constant state, or get surgery if it gets bad enough. And then they may have joint problems as well, and that may cause a big issue, and they may have pain and neck pain, and so they may just go to a physical therapist to manage that or use braces as well. So yeah.
Can you talk about the quality of life?
Well, the quality of life is that of a normal human. Other than that, they may have trouble getting around or reaching things, which is pretty obvious. They also may experience bullying because of their stature, but many other humans experience that as well.
Well, that's a wrap for today. Keep watching to learn more interesting facts about achondroplasia. Even though these are little people, it takes big bucks to afford all their surgeries. Open up your wallets and be generous and donate today.